After an auto accident, one of the most common things that is used to determine the value of a case or the settlement are the medical records or doctor's notes. And as we've mentioned in the 3 previous videos, there's some very common mistakes that happen in medical records that could potentially lower the value of your settlement or the claim. We've mentioned before about linking the accident to the injuries. We've talked about underdiagnosing. We've mentioned in the last video about lack of medical necessity, why each treatment or therapy was necessary for that particular day. In this 4th video, I want to bring up the idea of the amount of treatment somebody receives from an injury. The point is there can be over-treatment and there can be under-treatment. Either one can potentially devalue or lower the amount of settlement or claim. Now, what I mean by that is when we think back to when we talked about the diagnoses, every diagnosis has an acceptable amount of care, or an industry standard, if you will. Now, if somebody gets more care than the acceptable average, let's say, without proving why, maybe complicating factors or something like that, it seems as if the doctor is over-treating, and therefore the adjuster won't take the diagnosis and the case as serious. Now, on the other hand, again, because each diagnosis has a particular amount of care that's appropriate, if they see this particular diagnosis, then they see the patient has not gotten enough care. Well, in the adjuster's mind, they're saying, okay, this patient really probably wasn't hurt as bad because they didn't take their care seriously. So either way, under-treatment, over-treatment can potentially lower the value of your claim. That's why the doctor that you choose should be aware of these 4 things that we've talked about and make sure the notes are fitting the proper protocol, fitting the proper standards of care. If you've been in an auto collision, give us a call, 314-731-4383.